The alveolar wall has a thin and a thick the parenchymal connective tissue is not radiographically visible. And on low power microscopic sections of the lung, we can see very delicate thin structures that represents the walls of the alveolar sacs and of the alveoli. Note that we cannot identify connective tissue in the walls of these. A high-power photograph of the walls of an alveolus shows some cells and delicate structures, but we cannot see adequately the type of parenchymal connective tissue where these cells are located. This is a high-power photograph of the alveolo-capillary complex. The thickness is 2 micra. We can see the alveolus, the capillaries, and note that there is a thin wall that appears between both, and that is the site of gas exchange. This wall has the basement membrane of the capillaries and the pneumonocyte type 1 with a very thin wall, and it is at this level where oxygen is absorbed and CO2 eliminated. Also note that there is a thick side where we note the presence of connective tissue, and in this connective tissue we can identify cells. Some are macrophages or monocytes, some are fibroblasts, and this is the area of the lung that is not responsible of gas exchange, but here resides the endocrinological functions of the. A normal adult lung has about 300 million alveoli. These alveoli decrease as we age. The number of effector cells per alveolus is about 80. More than 90% are alveolar macrophages, which mostly derive from blood monocytes. 10% or less are lymphocytes of types B and T. Polymorphonuclear leukocytes are less than 1%. The internal diameter of an alveolus is 200 to 300 micra. The walls of alveoli between 5 and 10 micra in width. The basement membrane contains type 4 collagen. There are also glycoproteins that mediate the attachment of epithelial cells to type 4 collagen and other macromolecules, including proteoglycans. 1/3 of epithelial cells are type 1 cells. Fibroblasts account for about 37% of all parenchymal cells and occupy approximately 2/3 of the volume and of the interstitium. The most abundant interstitial matrix components are collagen type 1 and 3, and other matrix components include elastin, proteoglycans, and fibronectin. The alveolar pneumonocytes are of 2 types. Type 1 forms the blood gas barrier, and it has 0.1 micra in thickness and covers 95% of the alveolar region. Type 2 has laminated bodies and are the ones that produce the surfactant, which coats the inner aspect of an alveolus and prevents its collapse. Some years ago, I gave at the University Radiology academic group a paper that was entitled Axiomatic Rules in Pulmonary Radiology. One of the rules is that the parenchymal connective tissue is not radiographic.